Back to our top story now. When to reopen the United States of America. This as the number of coronavirus deaths in some hotspots across the country appears to be leveling off. Joining us now, Chief Medical Officer with Remote Health Solutions, also an emergency room doctor, Jon Baugh. Dr. Baugh, you are seeing hopeful signs there in Utah where you are, and the entire country is beginning to see some hopeful signs, is it not?
Yeah, thanks, John. Yeah, we are. I know that here locally we're starting to see maybe that we initially thought maybe we're just on the front end of the curve, but I think we're starting to see the effects of this flattening, and we're starting to see that across the nation. But I really think that what we're seeing is regionally and geographically, those differences are dramatically different. You know, we're not the same as New York. We're not the same as Jersey here in Utah. And those regional differences really make us look at how can we open America. And there's some great steps to be able to do that.
We just heard from a COVID-19 survivor, a patient who took hydroxychloroquine in the hospital, and he says it basically saved his life. You say there are a couple of other medications in the pipeline that seem to be very promising.
Yeah. So I got to listen to Dan when he was on your show just a few minutes ago, and I think that's fantastic. I know hydroxychloroquine really got the biggest press for a while. When I talk to my friends who are ICU doctors and internal medicine doctors across the country, what we're seeing right now in conjunction with the studies that are out, we're seeing that it's just not consistent. So we need that study. We need that data. Some of my friends are saying they're using it and they're seeing amazing results. Some are saying they're seeing it and maybe 50-50, and others are saying they're using it and they're not just seeing a difference at all. But there are a couple of others out there that are gaining some press right now. For instance, remdesivir. Remdesivir is an antiviral medication. The first test came out from Gilead. They at least released the first 125 of their patients in their study. They showed really great, promising results from that. They had 2 deaths in their 125. Most of those patients were released after a 5 or 10-day course of remdesivir. So that's one. And there's several studies going on with remdesivir. I think about 7,600 patients total are able to be enrolled in the Gilead trials alone. And then there's some other studies in China and elsewhere. We're going to really gain some great data. So that's one additional drug right there. Another that I was reading about recently is a drug that we have had around for a long time. Another drug is ivermectin. Ivermectin is an anti-helminth. So you think of it to treat parasites. It's a drug that I use when I go down to Dominican Republic or Haiti to do a service mission. We use it down there. It's known effects. But right now, it's only in vitro studies. That's all. We don't have anything in labs or in humans.
Dr. Jon Baugh, we appreciate your insight tonight. Thank you very much.
Yeah, thank you. Appreciate it.